Hi guys, hope you're doing well, hope you are thriving. My name is Doreen. If you're new here, you're welcome to the channel. People who have been here for quite some time, we've been doing a segment called Tales of Motherhood, and today we are taking a break because what we are going to discuss today does not only affect mothers, but it affects women in general. And with me is Dr. Rogers, who is going to introduce himself briefly, and then we get right into our topic for the day. Yes, Dr. Rogers.
Hello viewers. Yes, my name is Rogers Kajabwangu. I am an obstetrician gynecologist. I work with Mbara Regional Referral Hospital and Mbara University, where I was recently appointed as an honorary associate professor of obstetrics and gynecology. Yes, my work is really around women health. So I do see women with all sorts of conditions. I teach doctors who are going to be treating women, and I also do research on women health.
Yes, Dr. Rogers was my first pick when I thought about this topic because of your passion about women reproductive health. Yeah, I'm already seeing you running campaigns about women, their reproductive health and all that. I was like, this is the right person to come and share with us about the topic for today. Yeah, so today's topic is very near and dear to my heart because I've gone through it and very many women are going through the same, and that is fibroids. Today we are going to talk about all things fibroids. So doctor is going to start by telling us what fibroids are and different types and how someone can know that they have fibroids. Yes, doctor.
Yes. Thank you, Doreen. I think this is a very good initiative to share your experience, but also have people get some technical knowledge, technical view of things, so that in future they can make informed decisions.
Yes.
In the introduction, I didn't say that I am now the leader of all gynecologists in Uganda.
Oh wow.
And we appreciate such innovations.
Yes.
We want as many women as possible in Uganda to get the right information about conditions that affect them. So I'm happy to be talking about uterine fibroids today because one, it's a very common problem. We did research recently at the referral hospital, and we're just getting women who had come for various reasons and randomly doing ultrasound scans, and we found that close to 3 out of 10 of them had fibroids, and many didn't even know. But yes, let me answer the first question. What are fibroids? Fibroids are masses or tumors that are usually located in the muscle of the uterus. You know, the uterus has 3 layers. There's an inner layer, which is thin, then there's a thick muscular layer, and then there's another outer layer which is thin also. So the fibroids are what you'd call outgrowth or tumors or swellings in the muscle of the uterus. I want to mention right away that they are not cancerous, and they almost never develop into cancer. So I hope that can allay some fears, and also knowing that they are common. I think some people should find solace in knowing that it's not just you, but there are quite a number of people who are affected. Yes.
Yeah, and saying that they are common, when I shared that video, like, I got so much response from women who were not talking but were suffering silently.
Yes.
So like you said, it's good to have this information out there, people sharing their testimonies, people sharing their stories of what they're going through, how they are dealing, so that as women we can encourage each other to know that this journey that we are undertaking is this journey of fibroids. We are together in this.
Yes, yes.
Yeah. What are some of the signs and symptoms of fibroids?
Of fibroids. Okay, good question again. One is that many women have fibroids and they will even never know, because a number of the cases we see are what we call in medicine asymptomatic. There's no symptom, you just have the condition but it is not manifesting. So yes, asymptomatic presentation is one of the commonest ways fibroids present. But some women get heavy menstrual bleeding. So they have periods, but the periods are heavy and sometimes they take long. So that's another common symptom. Another one is pain, because this is a mass in the uterus, and so it occupies space and presses against the organs around, and so you can feel pain from that. Then depending on the organ that is compressed, you may get other symptoms. For example, when it compresses the bladder, you may find yourself urinating very many times. After a short time you're going to the toilet, because now the bladder capacity has reduced. It can only hold urine for a short time. Then of course some people get difficulty passing stool when it presses against the rectum, so you're not able to empty the rectum without difficulty. In a few women we see them struggling with childbirth, one beginning with infertility. You fail to conceive. I hope we'll talk more about that later on. But yeah, for some people it's the only symptom, just trying to have babies and failing. And others have pregnancies and just have bad outcomes, such as miscarriages. Yes, so the presentation varies a lot from one person to another, but those are the common symptoms. Yes.
Wow, some of them.
Yes.
I didn't even think in my wildest mind that there
Yes.
would be symptoms. For me, my symptoms were asymptomatic.
Yes.
Yeah, so when I was approaching 30, I was like, let me go and check if down there everything is doing well.
Yes.
And that is when I realized I had fibroids.
Yes.
Because my periods were normal, they were not painful, they were the normal 3 days. Like, I was not having any issues in my reproductive system, but I just went to check.
Yes.
And I guess this is to say that if you're a lady out there, I think 25 and above, or even 20 nowadays, you can just go for a checkup to check and see if everything is doing well on your reproductive system. And then if you've had any of the symptoms that doctor has mentioned, please also go for a checkup. It could just be that you're suffering from. Yeah, so once someone has found out that they have fibroids, are there any foods or lifestyle changes that they need to make, maybe to manage the growth or something like that?
I guess this is a good time, Doreen,
Yes.
to also to think about the risk factors that we know at the moment. One is not very pleasing because we don't know. We don't know what truly causes fibroids. We just know they are common, and we know a few things that increase the risk of having them. We now know that there's a genetic predisposition. If someone in your family has fibroids, then you have at least a slight chance of having them. We also know that fibroids thrive in an environment where there's an increase in the hormones, reproductive hormones of a lady. For those that know, the major hormones are really progesterone and estrogen.
Yes.
So in the presence of especially estrogen, fibroids grow, they thrive. So conditions that lead to that environment also may lead to someone, increase the risk of someone developing the fibroids. So quite a number of things. One is for people who for girls who start menstruating early, the risk increases, because when you start menstruating, it means that your body has started producing adequate hormones. So you're going to have that exposure for a very long time. Women who do not conceive, I know this discussion was on social media recently. Someone tried to bring it out. I think they were a bit impolite the way it came out. But it is true that a woman who has multiple births is kind of protected from fibroids, and the science behind it is that every time you get pregnant and you deliver, the uterus has a way, the body has a way of dissolving some of the tissues of the uterus, and the fibroids are also part of it. Also, a woman who does not conceive keeps on producing hormones without any regulation. Whereas, although hormones are still produced in pregnancy, but in a regulated manner. Yes, but the best explanation is perhaps what happens after delivery. So yes, not having children increases the risk, but this is only in comparison with people who have had multiple births. Yes. So yes, a few other things like being obese, because if you're obese, your body, some hormones are produced in the body fat. So you're again, like I said, increasing the hormones and leading to the fibroids continuing to grow. Yes, some research, especially in the Western countries, has shown that eating a lot of red meat for a long time can increase the risk. We haven't found it here, but perhaps it is good to note it as a risk factor, and quite a number of others which we would go through if we had a lot of time. But it needs to be put into context that these are just risk factors and they are not the actual cause. We do not know the actual cause. Some people will have all these and do not get fibroids. There are people who will not have any of these and end up having fibroids. So that is how it is.
Fibroids are really a mystery.
Yes.
When you talked about that controversial discussion on X,
yes,
I remember when I went to check, I asked the doctor, I was like, now what do I do? Like, he told me, you go and get pregnant. Imagine, I'm a young girl there, I don't even have a boyfriend, I'm just there, I have a problem that is scary, and you're telling me, just go and get pregnant. Yeah, so indeed fibroids are really a mystery. They are a mystery. You hinted on it about infertility.
yes.
Yeah, so maybe you can go ahead and expound more on that. Can they cause infertility? If someone is having fertility problems, like what should they do?
So fibroids can cause infertility, but again, not everyone who has fibroids will fail to conceive because it depends on a number of factors. One is on the location of the fibroid. The uterus is big and a fibroid will just be in a certain corner. If it, for example, is in an area where it is blocking off the tube, then you're going to struggle to have children. If it is in an area where it is distorting the endometrial cavity, where the fertilized egg is supposed to implant, then you're going to struggle to have children. But there will be so many people who will have fibroids, and their location will not affect conception and even carrying of a pregnancy. Yes, and the same really applies to the duration of the pregnancy. Some people who have fibroids will be able to carry a pregnancy up to delivery without any issue, and a few others, because again of the location of the fibroid, might end up getting some miscarriages or even delivering premature babies, depending on how the fibroid is affecting the cavity of the uterus.
Now that you talk about where the implantation happens, and I think you've talked about it, the miscarriage.
Yes.
I remember the first time I got pregnant, I got a miscarriage, and when I went to see a doctor, he said it was because of the fibroids.
Yes.
Yes, and yet the second time I got pregnant, I didn't get a miscarriage.
Yes.
So maybe it was probably where the egg got implanted in the two different circumstances.
It's possible.
Yeah. So if you've had a miscarriage, you can go and check with your doctor to see what the cause could be. You're going to tell us about the treatment options. So if someone has gone after watching the video, they have checked, they're like, they have fibroids, what next? Yes.
Okay, so here is the thing. You remember at the beginning we said that there will be many women who do not even have a single symptom. So those typically do not need treatment. If you're in the category of people who are asymptomatic, then you need to be at peace. You do not need treatment. What we do for you is what we call observation, where we just keep checking on you. For example, do an ultrasound scan every 6 months to see if the fibroid is increasing in size or even reducing. In some cases we find when it is reducing size. In a few cases we find when it's actually not there, when it's been complete, when it has completely resolved. So that is the first category of treatment modalities. The next is what we call medical management, where we give you some drugs. Now there's also quite a number of drugs that we use for women with fibroids. A number of them help us in reducing the symptoms. For example, if you're bleeding a lot, we have drugs that can reduce bleeding, and those can include even some of the common medications like ibuprofen. They can reduce bleeding.
Pain.
Yes. So those drugs manage both the pain, but also they can reduce the bleeding.
Okay.
So those are some of the drugs. We also have another category, which was previously rarely used, but we are now using it a little bit more. So these are drugs that can help with shrinking the fibroids. Not that I'm saying shrinking and not eliminating completely. So most people use them to reduce the size before surgery. We are going to talk about surgery as an option. But yes, they can reduce the size before surgery. Or if someone is close to menopause, because we know that in menopause, because hormones are no longer being produced, the fibroids start shrinking on their own. So if someone is very close, you may just give them that drug to reduce the size as she heads to her menopause. So we now have that. It's a drug called leuprolide, and it's an injection that can be given either monthly or every 3 months. And we usually do not want to give it for more than 6 months. So that is another category where we just give medications. And then we have the last one, which involves surgery. So surgery, like most people now know, can either be open surgery, where we open up, we make a relatively big opening and see the fibroid and remove it in what we call a myomectomy. Or it can be, you can do laparoscopic surgery, where just a pinhole is made and then a probe is inserted into the abdomen, and then the fibroid is removed. It has a camera so the doctor can see, and then they just remove the fibroid that way.
So how do they remove it? They pull it through the...
No, there's also technology for what we call mucilation. They crush it inside. Yes, they crush it and then suck out the contents. So that's what happens with laparoscopy. But the goal is one, to remove the fibroids, and in some women we just remove the uterus in what is called a hysterectomy. So that is mostly for women who have completed child delivery, and she's saying, I have finished my family, and instead of just removing the fibroids alone, just take out the uterus, because then that is going to protect her from even other conditions that can affect the uterus and cervix, like cervical cancer. Yes, so when she has that opportunity, we can do that. Yes. But for women who are still desiring to have children, we mostly do myomectomy, where we just remove the fibroid alone.
Especially if the fibroid has been causing multiple miscarriages.
Yes.
Like every time the egg goes to implants where there's a fibroid.
Yes.
Or when the fibroids are many in the uterus.
Or when there are many, or when they are preventing her from conceiving in the first place. Yes. So for those we usually want to do a myomectomy.
So this is $1 million question. When I shared my video, I realized that people were wondering, why did Doreen have to have a painless pregnancy with fibroids, yet for us, we are suffering in pain while pregnant?
Interesting, and it's puzzling for us, the practitioners of medicine, because conditions don't affect everyone the same way. For fibroids, for example, we know in pregnancy the commonest cause of pain is what we call red degeneration, where a lot of blood goes into, initially a lot of blood flows to the fibroid, and then blood stops coming. The fibroid grows much bigger, and then now it's no longer getting enough blood. So it becomes, when a tissue is not getting enough blood, it starts kind of like dying off, but it's not yet dead. What we call ischemia, and that is very painful. So that is what causes pain for most women who get pregnant with fibroids. But the good thing is it doesn't happen to everyone.
Yeah.
So that's why it probably didn't happen to you. But many women will have it. Yes.
And I really thank God that it didn't happen to me, because I did the first video I did like 3 years ago, but up to last month, someone was asking me, Doreen, did you get pregnant again? Was your pregnancy affected by the fibroids? And I told them, yes, I got pregnant and again didn't have any issues.
Yes.
You know? Then they asked me, after your first child, did the fibroids go or they came back? And before I conceived my second child, I think they were there, but very small, like 3 centimeters or something like that.
Yes.
Yeah, but another thing I would like you to talk about is degeneration. You talked about how when someone gets pregnant, in the first months of the pregnancy, the fibroids feeds off and becomes big. Because for my first pregnancy, in the first month, the fibroid came from like 5 centimeters to like 12.
Yes.
And then when it reached 12, now it started shrinking. Even the doctors were really surprised. So it started shrinking to a point that even by the time I gave birth, they were like 4 or 3. I was even tempted to push the baby. Anyway, let's not go there.
Yes.
Yeah, so talk about degeneration of fibroids. Like, what is that concept? Like, what causes it? Can prayers only work? Yes, talk about it.
So, degeneration is a term that just really refers to the different things that can happen to a fibroid. And there are quite a number. One is that it can resolve. Yes, it can resolve and just shrink without even any medication or any treatment. So that is one of the changes that can happen. A fibroid can grow, become very hard, like a stone, which we call when some calcium particles are deposited in it. So we call that calcific degeneration. So that can happen. I've worked on a few patients where you go to remove the fibroid and it almost looks like a stone. Yes. So that degeneration can happen. Then you also have another one where it kind of gets like fatty tissue, which we call fatty degeneration. Yes. So in those it will remain there, but the texture will be different from a person in whom degeneration has not taken place. So yes, degeneration is a bit complex. I hope our viewers are still following.
With us.
But yeah, it's just quite a number of things that can happen to a fibroid when someone has it.
Can fibroids completely go? Like, once someone has the fibroids, can they completely like disappear or heal, or can someone completely be free of fibroids?
Yes, in a small population of women, we see fibroids completely resolving without treatment, actually. Especially women who get pregnant and conceive. The magic is in the postpartum period, because when you are pregnant, the uterus increases in size, and then a number of changes have to happen to the uterus to get back to the size it was before delivery. And that includes resorption of some tissues. So when that happens, when that is happening, the fibroid is one of the tissues that are resolved. So for some women, there's complete resorption. For others, the size reduces significantly, and she just remains with a very small fibroid. The number can also reduce. Yes.
So you talked about the position of the fibroids. This is another question that came up.
Yes.
The ladies were asking, what was the position of your fibroids?
Yeah.
Okay, I think you talked about it, that the position of the fibroid affects whether you conceive or not, or whether the baby stays or not.
Yes.
Are there some fibroids that can be inside the uterus, or they must be in the uterine wall?
So they'll always be in the muscle of the uterus, but it can be very close to the inner layer, which we call the endometrium. So we call those submucosal. If it's very, very close to the inner layer of the uterus, then that's exactly where implantation takes place. Now, another one will be in the muscle, but the way it is positioned, it is altering the cavity of the uterus. So the uterus is like an avocado. Yes. So the fibroid might be so big that now it makes it shapeless. Yes.
Pushes into the uterine.
Yes. So So like it kind of just changes its shape. It's not just under the inner layer, which is endometrium, it's in the muscle, but the way it is positioned, it is just changing the shape of the uterus. So there you will have challenges with even the sperm itself moving up to meet with the egg to fertilize it. You'll have challenges with the fertilized egg coming back to be implanted. Yeah, so all those can affect reproduction. Yes.
Personally, all the questions I have have been answered. I have learned a lot. I don't know if there's anything else that you feel we should talk about, the topic of fibroids.
Maybe just to emphasize that they are not cancerous, and people who have them, yes, should be worried, especially if they are giving them the symptoms we've talked about. But for people who are not getting those symptoms, I know it's not easy to be at peace when you know that you have something that other women do not have. But sometimes the despair is so much, it's too much compared to the potential morbidity from the condition. And we see that a lot in women with fibroids. Yes, it's our duty as your doctors to keep encouraging you. Do not fear so much. It is a problem, but one can say it's not as big as cancer, especially if it's not giving you the symptoms. The symptoms incidentally can also be managed. And if you need management, it is still available. So that is where I see the peace should be coming from, that this is a manageable condition. Yes.
Okay. Thank you so much, Dr. Rogers, for taking off time to come and educate us about fibroids. I'm sure most of the questions that were in the comment section have been answered, but if you have any other question, you've watched to the end of the video and you feel like you have not touched my issue, please leave it in the comment section below. I'll again give it to doctor to answer it, then I'll come and give you the answer. Yeah, so thank you so much for taking off some time to come and educate us. We always pray before we leave. The topic of prayer is the topic we've been talking about. Would you like to give a prayer for women who are suffering with fibroids?
Sure.
Yes.
And dear Lord, we thank you for the time we've had here to share this important knowledge about this important subject with the women out there. But we know that there might be some who have been significantly affected by fibroids, who are having pain and discomfort from the symptoms, who are failing to conceive. We just pray that you will make a way for them, that you help them to get the right care and cause healing to the glory of your name. In Jesus' name we pray.
Amen. Thank you so much, Doctor.
You're welcome.
Yeah. Bye. See you in the next one.